Hi, everyone. Good evening. This is Ramina Zarm from Flex to Success Clinical Rehabilitation Services, and this is my video on dysthymia, also known as persistent depressive disorder. In the DSM-5, they changed the title of the illness, but the symptoms and criteria haven't changed at all. It's basically the same exact mental health disorder. So I'm just going to run through the definition of persistent depressive disorder, PDD, also known as dysthymia, and I'm also going to give an overview of different treatments that I've used, talk therapies that work with dysthymia. And I will also go over some medications that have been successful in quelling the symptoms of PDD. And then I will go over the side effects of those medications so we're all fully informed and aware of what we're getting into if we decide to treat this condition. So, persistent depressive disorder, what is it? Basically, it's a depressed mood, mild to moderate mood, that occurs for most of the day for at least 2 years, and that's for adults, and it occurs 1 year for children. So it's basically a mild to moderate, consistently depressed mood that for an adult would last 2 years straight. Now, 2 years is a long time to feel depressed. And that's the key component of this disorder that separates it from other depressive disorders. If you remember when I did the video on major depressive disorder, it was much it was a much shorter duration than 2 years, right? As well as the bipolar depression was a much shorter duration than 2 years. You didn't need to be showing symptoms for that long. But with dysthymia, the symptoms kind of persist, but they don't get as intense as major depressive disorder. They don't get as intense as bipolar depression. So that kind of outlines the difference between this particular illness and other depressive disorders. Also, the criteria for having dysthymia. So you have to have 2 out of 6 criteria. The first criteria is poor appetite or overeating. Some of this will overlap with other depressive disorders that I've done videos on in the past. The second criteria is insomnia or hypersomnia, also a very common symptom with other depressive disorders. The third one is low energy and fatigue. The fourth one is low self-esteem. The fifth one is poor concentration or difficulty making decisions. And the sixth one is feelings of hopelessness. So those are all symptoms of mild to moderate depression, which would make sense because that's what this disorder basically consists of. And if you notice, it didn't say anything about suicidal ideation because usually folks who are diagnosed with dysthymia, they don't show signs of suicidal ideation. But here's the thing, they could. You can have major depressive disorder symptoms for 2 years straight, and that can also get you a diagnosis of dysthymia. We would call that when you're showing severe symptoms of major depressive disorder with the duration of dysthymia, which is 2 years, we call that double depression because you're experiencing an intense form of depression for an extended period of time. So it's like you have dysthymia and major depressive disorder mixed together. So we would call that double depression. And it's brutal. It's very, very agonizing. Think about feeling depressed and having that feeling of anhedonia, which means, I reference this a lot. It means not finding pleasure in activities that you used to do in the past that you found pleasure in, right? An anhedonic feeling for 2 years straight. That's intense. That can really break down somebody's self-esteem. That can really make somebody feel like they're never going to get better. And that's why I can't encourage enough for people who are suffering from dysthymia to get help right away. Contact your therapist, set up an appointment, get in there and talk to somebody. What you're feeling isn't normal. It's not normal to feel depressed for 2 years straight. It's just not. Even if it's mild. To be mildly depressed for 2 years straight with no break is not a normal way to go about living. Even with something traumatic like the COVID-19 that's going on right now, it still isn't normal. It's abnormal to be depressed for 2 years straight, even during the grieving process. If you're ever having depressive symptoms for that long, you want to get in and talk to somebody. The average time that people get help for depression is way more than 2 years. It's like almost 4 years. Usually people wait like 3 to 4 years before they ever get help for depression. So I can't emphasize enough. Get in there, see somebody. Hey, maybe you can take, some tricyclic depressants. I'm sorry, tricyclic antidepressants, and they can clear you up and you can be back to functioning at full capacity in no time. It could be as simple as that. It could be as simple as some talk therapy. Maybe you don't really have dysthymia, but the only way you're going to know is if you go and talk to somebody and get their outside perspective from a licensed professional. A licensed professional who's a seasoned therapist will be able to see clues in your behavior and your body language and the things that you say and how you present yourself. And they'll be able to understand whether you have dysthymia or mild depression, or maybe you're just going through a stressful event and you're just responding to it. They'll be able to tell the difference between those three things. And a lot of it is time, duration, and intensity. Time, frequency, and intensity. So different types of therapies that work. Well, I'm really only going to focus on one because that's the one that I use when I address clients who have dysthymia. I use cognitive behavioral therapy, short-term cognitive behavioral therapy, short-term CBT. I feel like it's effective because when I've tried to use long-term psychotherapy on patients who have dysthymia, they don't really get much better. The short-term cognitive behavioral therapy is like a short-term brief therapy, and it kind of railroads the patient towards only the issues that matter, that are really causing them severe pain, discomfort, and contributing to their depression. You focus on those specific things and help them rectify those issues, whether it be past childhood trauma, whether it be a narcissistic parent, which is a very common characteristic of people who end up with dysthymia. They usually have a very overbearing, over-controlling parent. Maybe not necessarily a narcissistic parent, but a parent who tends to be very overbearing, dominating, and controlling. Think about that. If you have a parent who is constantly taking the driver's seat and making all your decisions for you, wouldn't that cause you to have low self-esteem and feel depressed? You're not making your own decisions for yourself. You're not in the driver's seat of your own life. Somebody else is dictating everything that you're doing and you don't have any say or input in it. That would cause anybody to feel some form of depression. But if you're feeling 2 years straight of mild to moderate depression, that's definitely a red flag, because that means it's beyond just the situational depression that's going on in your environment that's causing your depression. That means that there's got to be something deeper underlying that's fueling you to feel depressed for that extended amount of time. So just an important idea to look at when considering this illness. And the medications that work, it looks like tricyclic antidepressants are pretty much the best to help counteract symptoms of dysthymia. Amitriptyline, doxepine, nortriptyline, protriptyline, these are all tricyclic antidepressants that could be effective in combating the symptoms of this illness. The common side effects for those, I'm not going to name every single one here, but I know one is blurred vision. I know one is low blood pressure when standing. So you just have to make sure you're being monitored by a medical professional if you're going to go on any of these antidepressant medications, because you want to make sure that you're not having a, you want to make sure that if God forbid you have any chronic health conditions, those are identified before you start taking something. Like if you have hypotension, which is chronically low blood pressure, you might not want to take a tricyclic antidepressant because it's going to lower your blood pressure even more while you're standing, which could cause you to feel dizzy and fall down and possibly injure yourself. So just keep that in mind, that before you take any types of medications, you consult with your physician, you let him know what you're taking, and get his input on if he feels it's safe or not. So that's my presentation on dysthymia. It's a a very it's very difficult not to have empathy for people who are suffering from dysthymia, even though their depression never gets severe to the point where they're hurting themselves or other people. Usually it doesn't get that intense. It's still such a persistent, it just drags on for so long and it just becomes so frustrating. And that was one of the points I wanted to make, was that a lot of times in children, one of the common things that they will complain of when they're suffering from dysthymia is that they just constantly feel frustrated all the time and they don't understand why. Everything is just so frustrating for them, whether it be trying to learn in school or trying to make friends or trying to tolerate other people or trying to play a sport or trying to communicate. It doesn't matter what the activity is, anything that they have to focus their time, energy, and attention on becomes extremely frustrating for them. So that's a really important sign to look for when you're dealing with children, because a lot of times children are misdiagnosed with dysthymia and they end up with diagnoses of like ADHD or oppositional defiance disorder because the therapist is struggling and can't figure out what they have, and they're just seeing like a few behaviors and they try to put the whole thing together. Dysthymia, if you're feeling depressed for 2 years or more and you're having those other symptoms, is a good chance you have dysthymia. So make sure you're going to a mental health professional that has your best interest at heart, is competent in what they do and how they practice, and be selective when choosing your healthcare providers. And if you don't feel comfortable with someone, try someone else. All right, everybody, that concludes my presentation for today. Thank you so much for listening. Any questions or comments, please let me know in the comments below, and have a great night. Bye.